Hi, we're here today with Dr. Stefan Gopal. Hi.
Hi.
How are you?
I'm doing well. Thank you for having me, Mary. I really appreciate it.
Thanks for stopping by. So let's talk about you. Get right into it. Let's talk about your business and what you're doing.
Yes, so I actually am a physician as my second career. I've been practicing medicine for over a decade in the area, and just in the last year I opened up my own private, personalized concierge type practice that focuses on giving patients time to be heard and helping them find like the root cause of their issues. So it's evidence-based. I have a PhD in genetics of aging. I mentioned that I'm a physician as a second career, so I am board certified in family medicine. And then as I was practicing primary care locally here in Maynard with Emerson Hospital, and then when that practice closed down, I was with Westford Internal Medicine that's associated with Mass General Brigham. And during that time, as I was realizing that patients didn't feel like the medical industry was spending enough time with them and helping them be healthier, I actually got a second board certification in lifestyle medicine as well. So my clinic is located here in Westford. I do both in-person visits and telehealth visits, and we really focus on, it's over at the Circle Health building in Westford, and what I'm focusing on now is helping patients extend their health span and just live healthier and use all the tools and education at my disposal to work with them. And so we're really focusing on the prevention, the treatment, and even the reversal of mild to moderate chronic diseases.
And so when you say lifestyle medicine, is that what you mean?
So lifestyle medicine, so that's one of the specialties that I do. So family medicine focuses on everything in general. Generally, your primary care doctor is either a family medicine doctor or an internist. So they have many, many years of evidence-based traditional medicine. So I know all the meds. I also try to minimize them with my patients. But as I was working with my patients in primary care and recognizing that there was a lot of mild to moderate disease, whether that was mental health like mild anxiety, stress, or depression, or whether it was chronic disease related to heart disease, cholesterol abnormalities, metabolic disease like diabetes or something like that, a lot of the common denominators were lifestyle factors. And so that's when I became aware of the organization, the American Board of Lifestyle Medicine. And so I became board certified in lifestyle medicine, and they sort of focus on 6 evidence-based pillars. And so that is focusing on diet, exercise, minimizing true toxins like obvious toxins like too much alcohol, tobacco, or drugs, trying to get good sleep, which is always an important one for patients. Everyone seems to be struggling with that, or stress management. And then finally, the newest one as I did my training, because I was always working on those things with my patients, but how important healthy social interactions are. And the evidence is just overwhelming for these, that not only if we choose and follow and incorporate evidence-based, optimized lifestyle interventions in those categories, will we minimize our chances of chronic disease, but we can also treat and reverse that chronic disease. And what all patients, or at least what I've noticed with my patients, everyone is always wanting to get off medications once they're on them, kind of thing. And there is definitely data to support, and I've always been an advocate for using medications when they're appropriate, but trying to minimize those. And so in my practice, which is all about listening to patients and personalizing personalizing a healthcare plan to them, we can optimize medications, we can pursue lifestyle interventions, which then can result in the decrease or the removal of medications sometimes.
So you say concierge medicine,
Yeah.
you mentioned, and people get a little hyped up over that and think, oh my God, you know, I can't afford that.
It's actually funny that you say that, because as I was opening and branding my practice, I have always kind of shied away from being labeled concierge medicine, and I have only recently embraced it because I think it is sort of true. I am a concierge doctor, but people, like you said, they have connotations or they're not aware of what concierge medicine is. And so people always think of like, oh, for like the CEO and for the president and stuff like that, that's not affordable to me as the average person kind of thing. But there's actually been a movement for affordable concierge medicine, or there's other practices out there called direct primary care. And so why I now adopt and sort of accept that title of concierge medicine is, what it does state is I am private pay. So I no longer take insurance. And so you can go to my website, www.extendedhealthspans.com, and I have various different pricing options. But it's really about building relationships with patients, and so I kind of steer them towards, like, the flagship is really like a base model membership, which is affordable. Like, if you were to price it out, it's less than a cup of coffee a day. For people that truly value health and they're spending money on things like gym memberships or paying for personal trainers, my base membership is right in alignment with that. And what you're actually getting is way more than just access. Well, obviously I'm not access to a gym, but your membership gets you just access to that gym and then no physician or anything like that, or a personal trainer. And I work closely with these guys and they're great. But with me, you're getting what would be termed a concierge physician. So what you have is I have a small practice, so I get to know my patients very, very well. And the big thing about Extended Healthspans in my practice with that membership is so much more time spent with my patients. So right off the bat, we meet one-on-one over in that building. We spend an hour drilling down, getting to know each other, and that's even after they've filled out many forms online that I've reviewed to get a history before I even sit down with them, and then I just let them talk for that hour and what are your concerns, what are your goals, kind of thing. And that's where we start to put together their personalized plans. From there, in the membership, what they have is they have access to a concierge doctor, a physician scientist who's trained in all of these things, double board certified, and is there to help them with mild to moderate chronic diseases. So a little bit less than their primary care doctor. They're not coming to me for that, like, upper respiratory cold or that sprained ankle. They are going to their primary care doctor if they maintain one, or to an urgent care doctor. But when it pertains to lifestyle medicine or chronic disease, they can reach out to me either phone, email, or patient portal, and they're always blown away about, Dr. Gopal, you really did not need to get back to me about this question on diet over the weekend, or wow, thank you for calling me on the weekend, kind of thing. So just a lot more availability, and at like a what I think is an affordable sort of price point.
Right, what a great service. And when you say that double board certified and all of those credentials, you're talking about you.
Yeah.
People that sign up with you actually talk to you.
Yeah. So I am the lead physician. I am the doctor for all of my patients. This is a small sort of practice, so I do not have, like, you're not seeing a nurse practitioner or a PA. You're seeing me at every visit, and at, if I didn't mention it, after that first hour visit, in that membership, we follow up for half-hour visits every 2 to 3 months to check in on the personalized plan that we've created. And so that is always with me. For the patient's convenience for those follow-up visits, because a lot of this stuff stuff is checking in on a lifestyle-based plan or a behavioral-based plan or advanced testing results that we've done or are planning to do. I give them the option for those follow-up visits, which are a half hour long, just as a follow-up, which is oftentimes longer than a standard visit with a traditional doctor. In those follow-up visits, I can also, if it's more convenient for them, we can do it via telehealth, because oftentimes what we're doing is talking and reviewing information that we can do via video.
So how do you see yourself as a primary care physician, or do you see it as mostly, you'll work with other doctors, or if I have a PCP I love, how does that work?
Yeah, so I definitely think of myself as being very specialized. I mean, it was obvious even before I realized it. I was more specialized coming to this second career as a scientist, a biology professor, becoming board certified in family medicine, becoming actually a fellow for the American Academy of Family Medicine, which is the highest level of achievement a family medicine physician can achieve, becoming double board certified in lifestyle medicine. I very clearly have like a sort of specialist focus. So as I mentioned again, Extended Healthspans focuses on creating personalized healthcare plans focused on preventing, treating, and even reversing mild to moderate chronic diseases. So for most of my patients, they keep their primary care doctor either because they love them or because we can help support them. I very much take a holistic approach. I know a lot of the specialists in the area, so I take a team-based approach. While I don't practice alternative medicine, I have always been open to patients that see alternative medicine. And so I think of myself as kind of another quarterback that's helping them pull all of this stuff together. And so I help support their primary care doctor, who sometimes doesn't have the time to go into either listening to all their concerns or being able to advise them on cutting-edge guidelines that are changing in preventative medicine or in tests that we're able to do that we can personalize their sort of risk stratification so that we can say, hey, in your particular case, you may want to recognize that we're being aggressive with lifestyle interventions, but because you have this risk factor that your PCP wasn't aware of and didn't test for, we may want to add on that medication sooner rather than later. But again, that's your decision. I'm here to help educate and guide and help meet the patients where they're at and create a plan that they're happy with. And then that check-in allows us to see what is working, what isn't working, what do we need to change, or what do we need to kind of let slip by the wayside kind of thing. But lifestyle medicine is definitely a key focus of that.
So sort of the navigator of someone's health and the rest of their life.
Yeah, absolutely, and that's what I think. I mean, I've seen it so many times where patients just don't have enough time with their primary care doctor or specialist, and it's disappointing when they need help decompressing sort of that information, and so that's what I think too. Yeah, like decoding and understanding. And that was another one that I saw when I was doing primary care is I saw a lot of patients that just weren't taking medications because they didn't understand why a specialist had put them on this medication. And once I was able to take the time to explain them, hey, this is what this is for. Remember these new symptoms you're having, this new diagnosis. This is really going to minimize your risk of like a bad outcome kind of thing. And boom, they were very, very accepting of it then kind of thing. The other thing is, I mean, I love primary care. I mean, it was my start in the field kind of thing. But more and more, those primary care doctors only have so much time to spend with them. So the other thing that I do with my patients is I can help them organize and self-advocate and prepare so that they go in there and they know what to say to that primary care physician or that specialist so that they understand what's going on, and we can optimize the time. And I think primary care doctors are very happy to see that. And a lot of the primary care doctors and even specialists in this area, I am familiar with them because I've worked with them when I was at Emerson or Mass General Brigham. And so when they see that my patient, or that their patient is now my patient, they're like, oh, okay, this is a doctor that I know and trust, and he's willing to work with me, and so he's just trying to help me out. And so it's very much, I say, a team-based approach, even though Extended Healthspans is just myself. I'm part of your greater healthcare team that may include things like a personal trainer, an acupuncturist, a primary care doctor, a cardiologist. So I take all that information in those visits and personalize your healthcare plan.
Wow, I don't know why someone wouldn't do this. That's amazing, especially if you take your health seriously, which we all should.
Yeah, I agree.
All right. Is there anything else you want to touch on while we're talking today?
But the philosophy that I really take at Extended Healthspans, it's there on my website, but I think of it as a pyramid where we focus on a strong base of evidence-based preventative medicine. So that means doing things we can to prevent disease and screen for diseases appropriately and use the most cutting-edge technology. The next level of that base is relying on evidence-based lifestyle interventions that we touched on that we can use as treatments to help prevent, treat, or even reverse mild to moderate diseases, so that can help minimize medications. Again, though, I bring to the table traditional medicine. I know those medications. I can talk to you about them with the risks and the benefits so that you can decide when you feel like it's right for you. It's really cool because I can talk a lot more about cutting-edge tests that are out there that we know are evidence-based, particularly for heart disease. It's not as simple as what the primary care doctors often are talking about, the good cholesterol and bad cholesterol. There's a lot of other things that we can test for that really have changed the trajectory of how the personalized plans for some of my patients have gone, where we've wanted to be a lot more aggressive because they were at higher risk. As I mentioned, I know specialists, so when it becomes moderate to severe disease, I can help engage them with specialists that I know and trust that are working on the cutting edge, and I can help decompress that information after they're doing those visits, kind of thing. And then at the tippy top, I mean, my PhD, we didn't talk much about it, but it was in biomedical sciences, the genetics of aging, and it was really science fiction back then when I was in the lab. We were increasing the lifespan of fruit flies, but I was wanting to do more clinical stuff, and that's just not, longevity medicine wasn't a thing back then. But in the 25 years that I've become a clinician, longevity medicine is starting to become a legitimate specialty. And so this is for where, again, we've got a solid base, but the icing on the top for patients that are interested in like that biohacking or just doing everything possible that they can to be healthy. If they want to discuss supplements, I do generally recommend that we get most of our stuff from a healthy diet, but a lot of people out there have questions about supplements, and so I can help talk to them, help guide them to make informed decisions, kind of thing. But again, I think that like supplements should generally be minimized as much as medications, if not more so, kind of thing. Again, every patient is different. I have to spend the time with them to get to know them, to get to know their concerns, and then we create a personalized plan for them that we continually spend the time to check in on and evolve and keep them healthy and basically extend their health spans as long as possible.
So aside from looking at your website that you mentioned, you do have an offer for people that are interested.
Oh, yes, actually, that's a good point. So again, not to frighten people away from that term concierge medicine, again, this is affordable, but so that they can get more information about both the practice and how that paying works, although it's all right up there on the website. But what they can also do is they can go to the website and they can can self-schedule. I do free 15-minute, what I call like meet and greet or consult telehealth visits, where again, first thing I do in those visits is ask them, like, what are your concerns? What are you looking for? What do you think my practice can do to help you, kind of thing. Then usually at the we're like, okay, yeah, like, because I think that I could help almost anyone, kind of thing. So I'm like, this is perfect for you, kind of thing. Do you think it is? And then at the tail end, in the last minute or so, if they have any questions about how that membership or that payment model sort of works, then I can help explain that. And then hopefully it turns into a patient that becomes a member for life, kind of thing.
That's great.
Yeah.
All right.
Awesome.
Thank you.
Yeah, thank you.